Fact 1. Postpartum blues, when duration is 2 weeks or less. So, treatment is reassurance. If the symptoms are for more than 2 weeks, then it's postpartum depression, and we treat with antidepressants and psychotherapy. Psychosis, when it's delusions and hallucinations. Treatment is antipsychotics. Infantile spasms, ash leaf spots, subependymal giant cell tumors of brain, and cardiac rhabdomyoma. It's tuberous sclerosis. It's one of the neurocutaneous disorders. Antipsychotics may lead to increased prolactin. Post traumatic stress disorder. Treatment SSRIs and CBT. Optic nerve glioma and leash nodules, cafe au lait spots, and neurofibromas. It's neurofibromatosis 1. So, along with cafe au lait spots, it's optic nerve glioma and neurofibromas. When it's neurofibromatosis 2, then it's neurofibromas and acoustic schwannomas. Young female, blurry vision in one eye, monocular vision loss, and pain with eye movements. Afferent pupillary light defect and fundoscopy is normal. It is optic neuritis, mostly associated with multiple sclerosis. Cervical myelopathy, spinal cord compression. In older age, it is usually due to degenerative disease. Spinal canal narrowing causes spinal cord compression at cervical cord. Peripheral nerves are compressed, so symptoms are lower motor neuron lesions in upper extremity and upper motor neuron signs in lower extremity. On X ray, if widened mediastinum and enlarged aortic knob, it is blunt thoracic aortic injury. Boy with excruciating scrotal pain on diving in the pool, pain unrelieved by NSAIDs. It's testicular torsion. Diagnostic test Doppler ultrasound. And treatment surgery. It is surgical emergency. Circumcision reduces urinary tract infections in infancy. Malodorous off-bite vaginal discharge is bacterial vaginosis. Treatment metronidazole. Clostridium septicum is associated with colon cancer, so do colonoscopy. Dribbling of urine after voiding, but no leakage with valsalva or cough. Tender antevaginal wall with blood or purulent discharge. It's urethral diverticulum. Diagnostic test MRI pelvis, and treatment is surgery. Bupropion does not cause weight gain or sexual dysfunction. Lower abdominal discomfort, intermittent protrusion of rectum through anal orifice, erythematous mass with concentric rings, rectal prolapse. Most common risk factor is multiple childbirths. Resistant hypertension despite many antihypertensive therapies, systolic diastolic bruit in upper abdomen, renal artery stenosis. Jitteryness in a newborn of diabetic mother causes either hypoglycemia or hypocalcemia because osmotic diuresis may lead to decreased magnesium. Treatment magnesium and then calcium. Antidepressant contraindicated in bulimia, anorexia, and epilepsy. Bupropion due to low seizure threshold. Nasopharyngeal carcinoma is associated with EBV reactivation. Quick quiz. Effect of antipsychotics on prolactin. Increased prolactin. Postpartum depression, duration and treatment. More than 2 weeks symptoms. And treatment is antidepressants and psychotherapy. Infantile spasms, ash leaf spots. Tuberous sclerosis. Treatment of post traumatic stress disorder, SSRIs, and CBT. Optic nerve glioma, leash nodules, cafe au lait spots. Neurofibromatosis type 1. Acoustic schwannomas, neurofibromas, neurofibromatosis type 2. Young female, blurry vision in one eye, pain with eye movements, afferent pupillary light defect, fundoscopy normal, optic neuritis. Lower motor neuron signs in upper extremity, upper motor neuron signs in lower extremity. Cervical myelopathy, spinal cord compression. Widened mediastinum, enlarged aortic knob, blunt thoracic aortic injury. Boy with excruciating scrotal pain on diving in the pool, pain unrelieved by NSAIDs. Testicular torsion. Circumcision reduces UTIs in infancy. Malodorous off-white vaginal discharge, bacterial vaginosis. Clostridium septicum is associated with colon cancer. Dribbling of urine after voiding, no leakage with Valsalva or cough, tender antevaginal valve with blood or purulent discharge, urethral diverticulum. Bupropion does not cause weight gain or sexual dysfunction. Lower abdominal discomfort, intermittent protrusion of rectum through anal orifice. Rectal prolapse. Resistant hypertension despite many antihypertensive therapies. Systolic diastolic bruit in upper abdomen. Renal artery stenosis. Jitteriness in a newborn of diabetic mother. Cause and treatment. Hypoglycemia or hypocalcemia. Treatment magnesium and then calcium. Antidepressant contraindicated in bulimia, anorexia, epilepsy. Bupropion. Nasopharyngeal carcinoma is associated with EBV reactivation. Thank you.